Okay, so I think it is almost 9 p.m. and okay. So good evening, everyone. Myself, Dr. Vishal Srivastav, and today we will talk about a very contagious acute disease which is spreading more severely now. And many patients of this symptom is coming in the clinic, that is conjunctivitis. Many patients are coming severely affected with this contagious disease. So today in this session, we will mostly talk about what is conjunctivitis, the meaning, the definition of the conjunctivitis, what are the symptoms manifested in this disease, its types, complication, and the most important for which we all here gathered, that is homeopathic management. Means what the homeopathic medicines can be directly used in these cases of conjunctivitis. Okay, so can anybody is going to tell me that what is the conjunctivitis? What is the definition of this? Any doctor, please. What is the definition of the conjunctivitis? Any doctor can unmute himself and tell me the definition or the meaning of the conjunctivitis. Anyone, please.
Inflammation of conjunctiva.
Okay. Okay. So in this, we will talk about the definition, symptoms, types, complication, and the most important, that is homeopathic management. Now, the most important thing about the conjunctiva is basically conjunctivitis is inflammation of the conjunctiva. The inflammation of the membrane of the conjunctiva is known as conjunctivitis. Basically, the inflammation of this membrane creates a different color irrespective of white, that it may create the color of the eye, probably pink or red. That is why conjunctivitis is also known as pink eye, or the other name of conjunctivitis is eye flow. We will deal the pathological session or this type of session only for short period. Then we will explore the homeopathic remedy. So this is the conjunctivitis, that is the inflammation of the conjunctiva. The symptoms are coming in the different situation, that is varied symptom. But the most common is obviously if there is the inflammation, then there is the 5 signs of the inflammation. That can be redness, pain, sometimes the swelling. There is many times lacrimation is also seen in the conjunctivitis. And if the disease progresses, then there will be the formation of the pus, which may cause sticky eyes, sticking of the eyelids, mostly more pronounced in the morning. Sometimes sand sensation is also seen in the conjunctivitis, along with burning, redness, and inability to see the light. That is also known as the photophobia. So if we quickly recall the symptoms of the conjunctivitis, that may be a lacrimation, excessive discharge of the water, pus formation, which may cause agglutation or sticky eyelids, sensation of the sand in the eyes, burning, redness, and inability to see the light properly. That is a type of a photophobia. Further, the conjunctivitis is on the basis of the origin, on the basis of the cause, is divided into three parts. That may be obviously allergic, bacterial, and the viral. And if we differentiate on the basis of the symptom, that what is the viral conjunctivitis and the what is bacterial conjunctivitis. Difference between the viral and bacterial conjunctivitis. So if the discharge is more watery, like if we talk further in the euphrasia, the discharge of the euphrasia is severely watery, acrid, and maybe sticky. So if the discharge is watery and sticky, then this is the more manifestations of the viral conjunctivitis. And if the discharge is whitish or somewhat greenish in the color and sticky all the day, then it is more seen in the bacterial conjunctivitis. Okay, so if the discharge is watery and sticky only in the morning, this is more pronounced symptom of the viral conjunctivitis. While if there is whitish discharge or sometimes greenish or yellowish discharge with all the day sticky sensation, then this is more pronounced in the bacterial conjunctivitis. So till now we will talk about the definition, the symptoms, the types. The next thing, if it is been untreated for a long time, or if the prognosis has not been better with some types of the medicine, then there are sometimes chances of the secondary infection. That may be like blepharitis, keratitis, or obviously dacrocystitis. Please mute everyone. There are some sounds which is disturbing. Okay. So these were some, we were talked about the pathological aspects of what is the conjunctivitis, what is the definition of the conjunctivitis. Then at least we have somewhat the idea about that disease. Okay, now we will going to the most important part of the conjunctivitis, that is the homeopathic approach. The homeopathic approach, how we are going to treat the conjunctivitis, because this is a more manifesting disease, more manifesting acute disease, which is more frequently seen in nowadays a clinic. It is becoming from 10 to 15 days. So this is basically acute disease and have a lifespan or the period of approximately, I think, 1 week. It resolves in 1 week, and not more severe disease like COVID we have seen before. So we don't have to worry so much about this. And along with the eye flu or the conjunctivitis, in the rural area, as I practice on the weekends, in the rural areas, there is the boils in the ear is also more frequently coming. First discharge, it may be either due to the boils or due to the acute suppurative otitis media. So this is also a more pronounced disease coming nowadays in the rainy season, basically. Okay. So if we talk about now purely about the conjunctivitis, then homeopathy is basically given on the basis of the current scenario. Now the treatment of acute disease can be done by two methods. Obviously, the one some also do on the basis of the constitutional treatment. Many doctors treat acute disease also as a constitutional treatment. And the second type which we can use, that is a therapeutic approach. Because in the acute disease, the vitality of the patient is not so much decreased. That is enough. So on the therapeutic basis also, like if we giving just a small stimulus with a similar medicine, either it can be constitutional or either it can be pathological, it is more able to recreate or restore its vitality. towards the cure of the disease. So in acute, therapeutic approach is also as beneficial as constitutional. So if we're talking about the therapeutic approach, then wait a second. Okay, then let first symptom, if you see that patient is coming and the eyes of the patient is basically red, congestion and inflammation, initial stage. So this is a basically a small chart to just give a some probable medicine idea. So if the eyes is basically red, congestion and inflammation, means basically the first stage, then the probable used medicine is belladonna, aconite and ferrum phos. Further we will talk that I have divided the stage of the conjunctivitis in the three stages. In the first stage, we will talk about like the if the disease has been just start to the bloom, just it has been start to grow, then what the medicine we are going to use, or when it is middle bloom, what are that symptom, and in the last stage, syphilitic, sometimes if it is giving untreated, uncurable with probable medicine, then what are that condition will be created. Like sometimes we are going to see the further that is ulcer is also created in sometimes of the conjunctivitis. So that is basically a third stage medicine. So initially we use on the basis of the red congestion, that is belladonna, aconite and the ferrum phos. If the discharge is bland discharge, bland discharge means it is not excoriating in the nature, not acrid in the nature, then we can use allium cepa and pulsatilla. In pulsatilla, photophobia is not seen. Pathology, purulent discharge due to which, or pustular discharge due to which there is sticky eye sensation. The eyes start to be stick basically in the morning or whole the day. So that is agglutination or sticky discharge. So if the pustular discharge or stickiness is seen in the morning, then argentum nitricum is more pronounced. And if it is in the night, then pulsatilla is more pronounced. If there is granulation formation, then we can use thusa. Obviously, this is a just chart. In further PowerPoints, in the further slides, we will see each medicines, their modalities and their specification, how to use. Now, if the discharge is acrid, excoriating in the nature, then we can use euphrasia along with sometimes ars iode, arsenic iodum. And if there is excessive burning, then obviously arsenic, sulfur, and epis. Now, this is a basically rainy season in most of the area of the India. Like somewhere is excessive rain or somewhere is no rain, dry weather. So if the eye symptom is coming due to the rain, then we are going to use rustox. And if the conjunctivitis is become due to cold, not due to the rain, due to becoming cold, then we are going to use that is Dulcamara. Dulcamara is more cure rate in becoming cold. Like the patient is coming with the complaint that doctor, I have conjunctivitis and it has become when I have become totally cold, like in the coming in the AC or excessive cold airs, then Dulcamara is more pronounced. This is somewhat the acute chart of the conjunctivitis. Now we will explore each medicine, their symptoms and their use. So I have divided the stage of the conjunctivitis in the three parts. Like patient coming in your clinic, the doctor, I am suffering with flap points, that type of symptoms, and it has been just started just started, we can say a gap of a 12 hours. Like the disease has been started in the gap of only 12 hours. Then initially that is known first stage. And in the first stage, we are going to use these three medicine, any of three medicine based on the disease, based on the symptoms of the conjunctivitis. So initially in the first stage, we use ACONITE, BELLADONA, ferrum phos based on the symptom and based on the symptoms of the disease. Okay, so now we are going to use the next slides about ACONITE. What are the symptoms of the ACONITE in the conjunctivitis? So basically, everybody knows ACONITE is an acute medicine, and the process of the ACONITE, the manifestations of the symptoms of the ACONITE is so sudden, fast, and severe. Sudden, fast, and severe. So the patient will complain that doctor, somewhat I was good till the afternoon, but in the evening I'm feeling so much watery eye, so much burning in my eyes. It has been just started like 1 hour before or half hour before. Until then I was completely okay. So the symptoms of the aconitis is obviously acute, but extreme in the manifestations. The manifestations of the disease will be so much fast. And one important symptoms in the cases of the aconite conjunctivitis is seen, that is sand sensation in the eye. Like someone is stinging pain, stinging pain due to the sand is created in the eye. If we talk about the modalities of the aconite, then obviously it is a profuse watering, and aconite is always aggravated by cold water, wind, airs. So in the quick recap, aconite is basically acute manifestations with the full blown disease at just sudden, fast processing disease with sensation of sand in the eyes. There will be profuse watery discharge, and obviously it is in acute manifestation, so this will be a bland discharge, not purulent, not pustular, not in acrid nature. It will be bland watery discharge, which is aggravated by the cold water and winds. Now this is the first condition. Now the second condition, that second patient comes in your clinic that doctor, uh, I'm suffering with eye itching and burning and so much symptoms like that. And it had just started, I think 3 or 4 hours back. Until then, I was completely okay. So in some cases, like we have talked in aconite, the symptom started in 1 hour and the disease has been going to be bloom suddenly. But if the disease has been started and the nature of disease is too much slow, that doctor, nothing but just slightly redness in my eyes, but the disease is so much severe, contagious, and extremely has been widespread in my village. That's why I'm suffering. I'm fearful that I may also affect with this disease. Means there is slight symptom, but the patient is fearful about that disease only, not the symptoms has been so much bloomed. So in this case, ferrum phos is so much better indicated medicine. So ferrum phos is usually given when the symptoms is noticed without very much symptoms. So here redness has been just started to bloom. This is the only symptom. Sometimes it is also be seen that feeling of the tiny particle in upper eyelid. It is specific in the ferrum phos. Some particle is seen in the upper eyelid. Feeling there is sensation. And the third medicine which we use in the first stage of the conjunctivitis, that is belladonna, the most used medicine in this current scenario. And obviously everybody know clearly about the belladonna, the most first used medicine in the cases of the inflammation. So in the cases of the inflammation of the conjunctiva, the symptoms of the belladonna are, if you see this picture, let me, okay, okay. If you are clearly seeing this picture, the eyes, then if you can see the conjunctiva are completely red, like gun shots, bloody shot, extreme redness, along with the dilations of the pupil, which many times creates a staring look, like somebody is staring on you. So the symptoms of the belladonna is extreme red eyes, which is inflamed, painful, and hypersensitive to light, intolerable for light. Okay. Obviously, the most important pain of the belladonna, that is throbbing pain. Throbbing pain is seen in the eyes. But now, if it is a starting phase, not the pathology has been severe, so there will be no pus formation. In the belladonna, usually there is no pus formation. So there will be no stickiness in the eye, there will be no agglutination, and mostly used in the initial hours. So there is excessive red eyes, which is very much painful. There will be throbbing pain. Throbbing pain can also be seen in the head, and there is no pus formation. If you round off all, then the eyes will look like as a staring looks. So the three most important medicine used as first stage, that is ACONITE, then ferrum phos, and then belladonna. Now, if we're talking about the second stage, like pathology has been somewhat bloomed. The time of the disease, the origin of the disease has been approximately from more than 1 day. Now the symptoms will be somewhat changed. In the second stage, mostly we use the following medicine, that is euphrasia, gelsemium, arsenic, argentum nitricum, pulse, alumina silicata, rustock, acetic acid, and obviously the apis. Now, in the second stage, the most used medicine, that is euphrasia. Euphrasia is most used medicine in the second stage. Now, obviously, everybody know the discharge of the euphrasia is acrid eye, and if we're talking about just opposite, then the bland discharge is seen basically in the ilium cepa and pulsatilla. So the discharge of euphrasia is so much acrid with bland coryza. Many times in the euphrasia currently we see conjunctivitis along with the coryza. So the symptoms will be same. Acrid eye discharge will be, and along with this, bland coryza, which is mostly ambulated in the open air. Now this is just started the pathology. So there till now there is not so much suppuration, not so much pustular formation. So still the eyes will be sticky so much. It will just start to be in that stage. So the discharge will be watery, that is burning and excoriating, because acrid discharge, eye will produce an acrid discharge. So there will be burning along with excoriation of the near about areas of the eye. In some cases, swelling of the eyelid is also seen, and starting of the eyes to become sticky. Means eyes has been just start to become in the sticky nature. The second medicine which we used in the conjunctivitis, that is gelsemium. Now we will talk some only particular points about each medicine. not all the points, because pain, redness, burning, that is all approximately same. Now, what is the something different symptom of the gelsemium? Two more important symptoms seen in the gelsemium, that is dropsy, ptosis in the eyes. That is also known as the drooping eyelid. Like if you see clearly in this picture, the boy is unable to open the left eye clearly. So what happens basically in the gelsemium? Gelsemium is basically the medicine of drowsiness, dizziness, drowsiness, and so on. So in the gelsemium, the most important symptom of the gelsemium in all the acute disease is the heaviness at the eyebrows, heavy sensations, and heaviness in the head. Not actually pain. Pain is something different, and heaviness is different. Basically, in the gelsemium, heaviness is more pronounced. So, heaviness on eyes and eyebrows, due to which many times in the gelsemium, the patient cannot open the eyes. That is also known as the drooping eyelid. Now, the third medicine, which is most important and most usually using, we are currently after aphasia, that is arsenic. Now, arsenic is also known as the triose of the burning, like phosphorus, sulfur, arsenic. So, in the arsenic, there will be excessive burning, and the modalities are in the arsenic that they are becoming better with the warm water or warm thing, either internally, like cleaning with the warm water, or by applying externally, any external application of the warm thing. And along with this, all the symptoms will be same, like discharge of the eye, there is the burning of the eye, there will be the pain of the eye. That is all the common of the conjunctiva. But something different will be that there is emulsion from the worm, from either it is internally used or externally, with extreme photophobia. The patient will unable to see any light. And due to arsenic is also known as the triose of the burning. So there will be extreme burning sensation. Now, the third most important medicine, which is currently we are using, now the pathology is slightly blooming. The day of origin is going to be like second or third day. Now, what the medicine we are going to be used? The most important medicine currently, which I am giving in my rural areas, that is Argentum nitricum. Argentum nitricum. So the discharge of the in Argentum nitricum will be yellow. Now the pathology has been blown. Infection has become severe, and infection is going to be now purulent and purulent discharge, suppurative. So there will be pus formation, which that pus will form a sticky eyes. Now, yellow discharge is most important in Argentum nitricum, along with pulsatilla also. So if the discharge is yellow, then Argentum nitricum we can think of. This is causing a thick crust on eyelids. Due to that discharge, there is thick crust formation. The most important thing in the Argentum nitricum, the most important thing that is in the Argentum nitricum, that is granular conjunctivitis. There is the formation of the granules. If you clearly see this figure, then in the inner part of the upper eyelid, there is formation of somewhat granules, granular appearance. This is specific for Argentum nitricum in the acute phase. So Argentum nitricum is basically used in the granular conjunctivitis. And many times, not initially, but pterisium is also seen in the cases of Argentum nitricum. This is known as the pterisium. Pterygium basically a growth of tissues covering the pupils, going towards the pupils. So that is known as the pterygium, and more pronouncedly seen in the argentum nitricum. So commonly, argentum nitricum is more pronounced in the granular conjunctivitis, having yellow discharge, crust on the eyelid, and sometimes pterygium. Now, if you go further, then we are going to differentiate between pulse and argentum nitricum. Like the discharge is yellow in both, but usually argentum nitricum discharge is not so much thick as compared to the pulse. But honestly telling, the patient would not be able to differentiate between thin and thick discharge when you are sitting in the clinic. So the main difference between argentum nitricum and pulse is there is the burning sensation. There is so much burning in the argentum nitricum, which is absent in the pulsatilla. And the most pronounced symptoms of the pulsatilla is open air agglutination. So in the pulsatilla, the discharge is obviously we have talked that will be thick, yellow and profuse, and blend discharge without burning. There will be no burning in the pulsatilla. And the modalities are cold emulsion and warm room aggravate. Now, many times, like all the symptoms are looking the same. Sometimes some symptoms are so much prominent, like uh, a patient came, I think yesterday or a day before yesterday, with the symptoms of the belladonna. Obviously, that somewhat the patient become better, but the prominent symptom he was pronouncing that there is something, pinching my eyes, something like from foreign body sensation. That is also in the word of the materia medica, that is known as the sand sensation. Something picking, something stinging my eyes, sand sensation. And this is somewhat more pronounced in a medicine that was known as alumina silicata. So there is excessive sand sensation, and eyes are, burning like it has been coming so much from the smoke. And if you have to understand the condition of the alumina silicata, you have to imagine like in the village, in the winter seasons, mostly people sit near the fire to become himself warm. Usually old people sit. So basically that type of sensation, like smoky sensation, is seen in the alumina silicata. That is the more prominent sensation. Now, if obviously we have talked that if the conjunctivitis has been due to the rain, due to becoming wet from the rain, then we are going to be use rustox. The symptoms of the rustox is basically thick, purulent discharge and hot. There will be lacrimation, and the other symptom of the rustox, that is restlessness feeling, like arsenic. The rustox will be so much restlessness and become aggravate in the time of the midnight. All the symptoms of the rustox has been pronounced with the restlessness and aggravation from the midnight. And there is something peculiar sensation in the rustox that, patients say that, doctor, someone is pulling my eyes. In the rural area, they cannot explain the symptom clearly. So they just say, the doctor, someone is pulling my eyes. So basically, this is the pain behind the eyes. This is pain pronounced behind the eyes. So in the rustox, the conjunctivitis occurs due to the becoming wet from the rain. The symptoms will be the discharge will be thick, purulent, hot. There will be excessive lacrimation, restlessness, which will be aggravate about midnight. And the most important point of the RHUS talks is pain will be behind the eyes. Now the pathology is going to be bloom and bloom, upgrading himself the pathology. So a condition comes in which there is excessive purulent discharge, excessive suppurative discharge, due to which the patient will be unable to open the eyes. Like so, patient comes in our clinic and he is unable to open the eyes, not due to the swelling of the eyelid, because of sticky mucus, tough mucus. All the symptoms of conjunctivitis, but the patient is complaining, doctor, I'm unable to open my eyes. So this occurs basically due to the swelling of the either upper eyelid, either lower or both eyelids. But if it is not due to the swelling, but if it is becoming due to the excessive mucus, stickiness, then we are going to be use acetic acid. Acetic acid is a wonderful medicine when the patient becomes unable to open his eyes due to the tough mucus. The last medicine which we are going to use in the second stage, that is epis. So obviously the more pronounced symptom of the epis is there is the swelling of eyelid. Swelling of the eyelids. So there is a question to just check all the doctors are sleeping or waking. Which part of the eye is becoming swell in the case of epis? Is it upper eyelid? Is it lower eyelid? Or both eyelids become swell in the cases of the epis?
Lower eyelid.
Okay. Any doctor else?
Sir, the upper eyelid.
Okay. Okay. So this is something homework for you all. You done by it's your own choice. Search it. So in the epis, basically there is the swelling of the lids, which creates the most prominent symptom of the epis, that is stinging pain. Like something is stinging nature, like bryonia, the calicar, stinging pain, and photophobia. The patient of the epis is also become unable to open his eyes, but it is due to the dropsy of the eyelids, due to the swelling of the lids. And the modalities is in the epis, it become immersion by the cold. The most prominent medicine which we differentiate in the cases of the eye, that is epis and arsenic. In the arsenic, the modalities are they are become emulated by the warm thing, and in the epis they become emulated by the cold thing. And the most important symptoms in some patients seen that their blindness, their acute blindness become aggravated by the stool. The second most important symptoms which is seen in the epis, that is their vision is not fixed and they become aversion to using home lights, artificial lights. They become good in the rays of the sun in the noon, but they have some problem along with the artificial lights. So basically there is a swelling of lids due to which the patient is unable to open their eyes. Only 10 to 15 minutes lectures are remaining. Just we are proceeding on the third stage medicine. Only 5 or 6 medicine in the used in the third stage. This is a stage in which the patient is going in the syphilitic stage, may create excessive discharge, excessive suppuration, excessive blindness, or excessive syphilitic stage, that is formation of the ulcers in the cornea. And then we will produce 1 or 2 chart, thoroughly chart, which will help you to solve the cases of the acute eye flu immediately. So the next medicine which we used in the third stage is basically used when the pathology has been become from 4 to 5 days and the patient is already taking the medicine, but the medicine is not helpful for him, not is improving. So obviously, if the medicine is not helping, then the pathology will be blooming. So in that cases, the patient reach in the third stage. It will create a syphilitic origin or somewhat create vision issues. So going the next medicine, that is HEPAR. Obviously, everybody is know HEPAR is the medicine of the suppuration, purulent discharge. So in the HEPAR till now, the discharge was basically watery, less purulent. But in the HEPAR, the discharge will be more purulent in the nature, which will be aggravate, their eyes will be aggravate by touch and uncoverings. Why the HEPAR become aggravate by uncovering? Because HEPAR is known as the one of the most chilly medicine of the materia medica. So till now we have seen in the HEPAR there is the inflammation which is excessive offensive due to the purulent discharge, aggravation from touch and uncovering, and there is starting now vision issues from there. From now there will be vision issues in the medicine. So in the HEPAR object basically appears in the different color. So in the HEPAR the appearance of the object is basically red or too much large, and the sight of the vision is reduced to half. Means if the pathology has been not cleared with any similar medicine, then the vision of the HEPAR change and reduced to the half. And due to the excessive suppuration, there is chance of ulcers of the cornea in the HEPAR. Starting ulcer of the cornea in the acute phase, we are going to be use HEPAR. Starting stage of ulcer of the cornea. Now the pathology is going to be somewhat syphilitic. Then syphilitic medicine will be going to be used. That is, the next medicine is Kali iode. So in the Kali iode, there is copious thick green discharge. Greenish discharge will be, and there will be the most important symptom, oscillations of the eyeball. Potency of the HEPAR is 30. Or depend on the symptoms, you can use 1 m also. In 1 or 2 cases, I think I have used 10 m. So Kali iode. Basically, the greenish discharge is important, and there is oscillation of the eyeball. Oscillations of the eyeball. Till now, the winking or closing the eyelids is somewhat not painful because not so much suppuration has been occurred, not so much eyelids has been affected. But from the Kali iode, due to eyelids affections also, there is painful winking. Painful winking, and this winking basically in the Kali iode become painful due to the twitching conditions of the eyelids, more pronouncedly lower eyelid twitching. The next medicine after Kali iode, that is MERC core. So vision issues has been started from the HEPAR. Now in the MERC core, like we have seen in the HEPAR, objects appears large, but in the MERC core, object will appear small with excessive photophobia. Now the pathology is going to be in the ulcerative stage. So when there is ulcer formation or when the pathologies become blooming, then their small pathologies obviously become short. So the pus formation now will become so much less. Little tendency to form pus in the MERC core because these are syphilitic medicine. They are either soric form or mostly syphilitic form. So psychotic phase is so much reduced. So there will be soreness, there will be excessive photophobia with objects appear small, pain behind the eyeball, and ulcer on the cornea. Cornea ulcer has become start to be in the middle stage comparison to the HEPAR. Now the last medicine which we used in the third stage for vision issues, that is MERC. Everybody know syphilitic medicine. So MERC usually used when the deeper pathology has been involved. The pathology has been going to be deeper. Now, if you also see in the MERC, the discharge is basically acrid and watery. Watery discharge. Why watery discharge? Because the pus formation has been decreased. So in the MERC, basically deeper pathology is going to be used. The watery discharge along with the profuse acridness, and basically the patient is become unable to open the eyes because of excessive ulcerations of the cornea. These medicines are chilly, so they will be become good with the somewhat heat appliances. The next medicine which we used, that is CALCAREA iode. Obviously, CALCAREA iode is a psychotic medicine. So in the cases of flycutinular conjunctivitis. Flycutinular conjunctivitis. What is this? Flycutinular conjunctivitis is basically a nodular formation in the eyes. Like if you clearly see in the picture, there is somewhat nodular appearance. This is, if you see, there is the nodular appearance in the eyes. So whenever there is the nodular appearance has been started, we are going to use CALCAREA iode in the acute condition. The next medicine and the last medicine, like suppose we have obviously explored many medicines of the acute conjunctivitis, but suppose due to patient is coming with the complaint, the doctor, conjunctivitis has been so much improved, but still I'm facing vision issues. Like yeah, I'm okay with the conjunctivitis, but vision issues is there, or there is the no swelling of the eyelid, no so much agglutation, sticky eyes. Still the patient is so much manifested with the vision issues. Means the conjunctivitis symptom is not so much aggravated, not so much frustrating the patient. The patient is only frustrated with the vision issues. Then the last syphilitic medicine used, that is Manicella. Manicella is medicine basically have a capacity to produce acute blindness for some days. It can be manifested due to the any acute eye symptoms or somewhat used in the chronic phase also. So it is acute blindness for some days due to any eye trouble. So these somewhat medicine we have discussed till now. Now we will have a more chart to clear the medicine. Like suppose in the conjunctivitis, both eyes has been affected. But if it is starting from the right or from the left, so obviously if there is the right origin, then we can think of apis, lycopodium, belladonna with the photophobia, argentum nitricum, and if it is with the cuff, then antim tart. Similarly, if it has been started from the left side, then we can use rustox, euphrasia, nux vomica. Nux vomica is also used with allergic coryza. Like we have seen in the classification of the conjunctivitis, that is allergic conjunctivitis. So if there is the allergic conjunctivitis, nux vomica is a wonderful medicine. And the next medicine which have origin in the left side, that is Cassia sofera. The next thing, the next chart and the last chart of this session, that is modalities based on the modality. So if there is the aggravation from the cold, If the symptoms is going to be aggravate from the cold, then the medicine used, that is Rustox, HEPAR, obviously all the chili medicine will have complaint with the cold. So all the chili medicines get aggravated from the cold, that is Nux vomica chili, Euphrasia chili, MERC.
Why?
If the patient is hot, like apis, pulse, sulfur and argentum nitricum, then their complaint will become aggravated in the warm. So cold aggravation in Rustox, HEPAR, Nux vomica, Euphrasia, Merxol, Bell, Aconite, Ferrum Phos, and in the warm, apis, pulse, argentum nitricum, sulfur. So that is all about today's session. We have done almost most probable medicines. The most probably using medicine which we use currently from these type of medicine, then that is Euphrasia, Belladonna, Argentum nitricum most used, Rustox, and Apis somewhat. Sometimes pulse is also more pronounced, and sometimes phosphorus also. These 7-8 medicine is more pronounced, but we have dealt about 17 to 18 medicine. So that is all about today's session. There is one announcement. There is one announcement. Like we are going to create a polycrest session from 7th of the August, from after 2 days. So that will be session of two polycrest remedy with the two case. With that will be visual session. So if anybody is interested, they can message me personally. They will be added to the paid group, and there will be lecture occurs. That will be manifested in the both language. That is one day Hindi language and the second day in the English language. So thank you all of you.
Sir, can any
Uh,
preventive be given regarding conjunctivitis, like to prevent the conjunctivitis,
mm,
sir?
Basically, this is not there is no any preventive medicine, but usually I have used Euphrasia in 4 to 5 patients, and they are not complaining anything. Either their family member is suffered with the conjunctivitis. So basically, you can use Euphrasia,
Potency, sir?
30 potency, because we are here talking on the pathological or somewhat disease based. So you can use 30, but if you are too much sure about medicine, then you can use 1 m or 10 m also. I've used many times 10 m because sure of the medicine, sure short medicine. Those who want to join, they can personally message me at I'm sharing just number in the chat section, 8543839299. I've just dated 8543839299. You all will be those who want, they can personally message me. They will be added to the paid group, and the session will start from on the Monday. Any question want anybody regards with conjunctivitis or today's session?
Sir, will we get a
Yes.
recording of this?
Yes, ma'am. Probably our team will upload this on our YouTube
Because
channel.
we
Probably.
would like to revisit it. We missed some parts.
Yeah. Okay. Okay, we will
So
upload
thank
and
you. Thank you.
yes. Welcome.
Sir, I have one issue.
Yeah.
Hello.
Yes, ma'am.
One case, they are suffering with redness from 2 years. There is no inflammation and no sticky discharges and no other problems. Only they have becoming a redness. Overall, the day, his eyes was very dark red.
Mm-hmm.
So, they told the allergic eye conjunctivitis. They walk in
Mm-hmm.
the some bangle shop. All
Mm-hmm.
bangles having some what we call merpulu.
Mm-hmm.
Is it
Okay.
comes from what we call that? I'm giving epis and ferrum fast, but minimum reduced the problem, but still they have the problem.
Ma'am, actually, that is a chronic manifestation. So obviously, you have to go with the constitutional medicines because chronic in the chronic scenario we cannot just tell. But yeah, if you want, I have treated this type of case somewhat with the Calcarea carbonica. I have treated many cases, I think, with the Calcarea on the basis of like this is the most important symptom of the belladonna. But belladonna is a type of acute medicine. So the belladonna is the acute of the calcarea carb. So many times calcarea carb become beneficial, but yeah, you have to go with the constitutional if calcarea carb is not going to help.
Okay, sir. Thank you.
So I have just written my number. If anybody wants to be added in that group, you can message me there. Okay, so I think every issue has been cleared. So thank you everyone for being here. Good night. Good night, everyone.